Everyone, thanks for joining me for my class today. We'll be going over how to perform an arthrogram according to the Foundation Surgical Hospital Protocol. Our objectives for today are to identify all supplies needed for an arthrogram of the hip and shoulder, identify all paperwork needed and how to properly fill them out, and effectively explain the procedure to the patient and give aftercare instructions. So here's our supplies that we need to set up the tray for the radiologist. I'm going to go ahead and go over them one by one if you want to follow my mouse. This first one here is the sterile labels with the permanent marker. These labels will go on each syringe, and that is very, very important since each fluid coming out of the vials will look exactly the same. The second one here is the aperture drape. It's the skin drape that'll go over the patient's skin in the ejection site. This here is ChlorPrep. It's the radiologist's preference for cleaning the skin. Here we have a 20 ml syringe. This is the 22 gauge 3.5 inch spinal needle. The only thing I left off here, which is a rare case, but sometimes we'll use a 5-inch needle if the patient is a little bit bigger. Here we have a 1 ml syringe. This blue needle is the 25 gauge 1.5 inch needle that will go on the lidocaine syringe. Here we have the Mayo stand cover. This is the arthrogram tray, and here we have 2 sets of sterile gloves, one for the tech and one for the radiologist. The last of the supplies will be multi-hands that will be mixed with the 2 saline flushes. These are 2 10 ml saline flushes. This is a 30 ml IsoVu 300 vial. That is the first contrast that we'll be injecting. And the last one is the local anesthetic lidocaine that we'll be using. So to set up the tray, we'll go ahead and put all of our supplies onto the sterile tray, with starting with the Mayo stand cover. After that, go ahead and drop everything except for the sterile gloves, of course. So once we have the arthrogram tray open, we won't necessarily be using all of the supplies here. So if you look at picture B, right around here where my mouse is, these are the supplies that we took from the arthrogram tray. So we have a bandage, 2 10 ml syringes. This is a cover that'll go over the tray once everything is complete. We have 2x2 gauze. We have an 18 gauge 1.5 inch needle, which is the pink one. We have a 5 ml vial of lidocaine and the tubing for the syringes. So if you look at picture C, this is the completed tray. The first syringe we have here is a 10 ml syringe filled with 10 ml of lidocaine. Right here we have the blue needle, which is the 22 gauge 1.5 inch needle. Next we have the spinal needle. Syringe 2 is a 10 ml syringe filled with 10 ml of IsoVu. Go ahead and flush out that tubing after you attach it to the syringe. Make sure there's no air left in that tubing. Syringe 3 is the 20 ml syringe. It is a mixture of the 20 ml of saline and the 0.5 ml of multi-hands. It's very diluted, but this is what we'll use as far as MRI contrast. Next we have the aperture drape, the bandage, and the gauze. And here we see that the cover goes over the whole stand just like this. We'll go ahead and cover it while we get the patient prepped and bring the radiologist in. Now, going over paperwork, if you're reading along with me, if you see an asterisk that indicates that there's a reference. So those references are at the end of this presentation. So page 1, we have the exam checklist. This is only for the the technologist's preference. The tech will check off what is applicable to the exam. If anything is not applicable, there will be an NA section. Page 2, we have the invasive procedure consent. This page goes over the risks of the invasive procedure. It's very important to go over these risks with the patient. The list includes bleeding, bruising, infection, scarring. There's a few more on there, but these are the main ones. And it's good to let them know because sometimes things can happen, especially like the bruising and the scarring, that they're not expecting. Most of the time the patients just feel sore though. This particular page will be signed by the patient, the technologist, and the radiologist. Page 3 will go over the contrast risks. This is also a consent page. It'll go over the risks involved with getting contrast. There's a brief questionnaire attached to that consent form just to outline any contraindications that there might be, such as kidney disease. This page needs to be reviewed with the patient since there's always the possibility of an allergic reaction. Um, it it's a very small amount of contrast, but the risk of a reaction is still there. So we go ahead and go over that with the patient. This will be signed by the patient and the technologist. Also at the bottom of this page, there is information for the contrast. What you'll need to put is the time of injection, the location of the injection, name of the radiologist injecting, the lot number and expiration on the vial, and the amount used. Page 4 is the history and physical. This is where you'll go ahead and record the patient's history about the injury, how long has it been going on, what exactly happened, any prior diagnosis to this site that we will be imaging, medications that the patient is taking, any blood thinners or anticoagulants, and any allergies. This paper will only be signed by the radiologist. Now, page 5 will be a timeout form. This page will have several boxes, so you only check the ones applicable to the arthrogram. Once everything is checked off and you verify that all the information is correct, such as name, date of birth, procedure, and injection site, you can go ahead and get started. The tech will sign this page, also with the date and time that the timeout was done. Now, this is an exception down here. If you'll look right here where my mouse is, a separate pregnancy form will be used for women ages 13 to 55 years old. I'm sorry about that. This will be signed by the patient and the technologist. Now, I will make a note here. When you take your quiz, this is not an option, okay? You'll recognize the question and what I'm talking about, but don't worry about this as far as the question on the quiz, okay? Now, setting up the room is fairly easy once everything on the tray is set up. This is the radiologist's preference for setting up the room. Now, this room is set up for a right side arthrogram. As you can see here, the pillow is here and the patient's right side would be along the edge of the table here. Make sure that the bucky is out of the way. The radiologist's chair is right here in the middle of the table, his foot pedal here. The tray is right here at the head of the table, and the monitor is right behind the tray. So everything is set up and he's ready to go. The only reason we don't have a patient here is for HIPAA reasons, of course. Now, explaining the procedure can be probably the longest part of the whole thing. There's usually a lot of questions accompanied with explaining the procedure. So there's a few key points to hit that can sometimes prompt those questions and make the patient feel a little bit more comfortable. So the first thing that's going to happen is that the skin will be clean, draped, and numbed. The numbing is probably the most painful part of it since lidocaine can kind of sting for a few seconds. The contrast is going to go ahead and go directly into the joint, not through an IV. This is a common question when patients have had a previous MRI or CT that involved contrast. Um, Here we talk about the fluoroscopy. The fluoroscopy, sometimes you can use x-ray for the layman's term, since a lot of people who do not work in radiology don't know this word fluoroscopy. The x-rays are to make sure that the needle is in the correct spot, and the contrast is also for that reason. Um, Now, for the last one, we always ask if the patient has any questions and answer them fully. If the question is above the technologist level, let the radiologist go ahead and answer that. Now, this would involve things like diagnosis, what do you see, what will you see, things like that. All we can do is let them know that the radiologist will be in a few moments and that he'll go ahead and answer those questions for them. Now, the follow-up instructions are pretty clear. Keep the injection site clean. Call the hospital if there's any signs of infection. Expect soreness from the site. That's really important to let them know because they might not expect soreness or anything like that. They might feel like since the lidocaine is still numbing them, they won't feel anything for the rest of the day. But more likely than not, they'll go ahead and feel some soreness for the rest of the day. Go ahead and let the MRI tech answer all the questions about the MRI portion of the exam. Um, Now, this is an exception, of course. If you have your MRI registry, then by all means, go ahead and let them know what will be going on. If you are a RTR, I would go ahead and just let the MRI techs answer those questions. Last but not least, go ahead and let the patient know that there will be a report ready by the end of the day and to follow up with their referring doctor whenever they're ready. Now here's our references. These are going over the risks of the injection of contrast, also the risks of an invasive procedure. Um, these are really great articles, especially talking about the allergic reaction to contrast media right here at the bottom. Now, when you're ready, if you go ahead and click here, it'll take you straight to a quiz. There's 5 questions. Go ahead and answer them the best you can. If you'd like to review the PowerPoint a little bit more, feel free. We'll go ahead and click here to take a look at the quiz. We'll give it just a few moments. All right, so here's our arthrogram quiz. There's 1, 2, 3, 4, 5 questions, like I said. Go ahead and submit whenever you're ready. And that will be it. I really hope you enjoyed this class. I hope you learned something. And I look forward to hearing from you. Thanks.